Okay. Let's see. So single position spine surgery is not a new concept. We've been doing this all this long. It is basically 360-degree fusion surgery without having to change the position. P-lip and T-lip, they are all single position spine surgeries. The advantage of this procedure is obvious. You don't need to flip the patient after in-body work, and it is time and resource efficient, and it's less hassle to schedule the procedure because you don't have to rely on excess surgeons. Then why does anybody still do L-lip and PSF? Well, despite this procedure is inefficient, there are some advantages. And with the L-lip procedure, there's less neurological complication as the cauda equina is not manipulated, and there's large bone implant contact surface, which creates a very stable environment for the fusion. And because you can put a very large implant between the vertebral bodies, you can have indirect decompression with the ligamental texts as well. Because you are putting a large implant, and the deformity correction is going to be much better as well.
Sean?
Yeah, I'm trying to go to the next slide.
Dr. Kim, we can't hear you.
Can you hear me okay now?
Yeah, we can hear you.
Okay, great. Okay.
So I
Then
think lower left, if you click on there, there should be some symbols that show up, and it will show you. There we go.
There you
Got
go.
it. Yeah, there we go.
All right. Sorry about that. And we discovered lateral lumbar interbody fusion surgery, early procedure. It is MI's procedure where decompression of spinal canal and the reduction of the spinal deformity is achieved with the ligamental plexus and facet distraction through a transverse approach. Cauda equina is not manipulated during these procedures, and then you can put a very large implant in between. This large bone implant contact surfaces create a stable environment to facilitate the fusion, and non-union is rare with early procedures. And implant placement is done on the ring apophysis, the strongest part of the vertebral body, and there's going to be less subsidence of the graft and better deformity correction with a fewer fused segment. So this is some of the example of indirect decompression with lateral lumbar interbody fusion surgeries. So L-lip has all the advantage of the L-lip procedures, and most importantly, procedures being done in lateral decubitus position, and which leaves the posterior aspect of spine accessible without having to reposition the spine surgery. So L-lip is the beginning of the new modern sense of SPS. L-lip, however, is not a perfect procedure, and you are performing the procedure in the middle of the lumbar plexus, and there can be a lumbar plexus injury, big and small, and the difficulty access to the L4-5 could not be addressed, and you cannot access L5-S1 with L-lip procedures. And all it came along is Antisource approach. It has all the advantage of the L-lip procedures, and it addresses the concern of the lumbar plexus injury, and it addresses L4-5 access problem, and you can also access L5-S1 as well. You position the patient in a lateral decubitus position, and you perform anterolateral lumbar interbody decompression and arthrodesis. And then you go behind and you perform pedicle screw fixation. This procedure only takes about 90 minutes to perform. So the advantage of the L-lip procedure plus posterior spinal fusion SPS over the T-lip and the PSF is you can do indirect decompression of the spinal canal without laminectomy, and there's not going to be a cauda equina manipulation. You can place very large implants, so their interbody contact surface is much larger, and there's a less graft subsidence, better deformity correction with the shorter fusion segments. L-lip plus PSF SPS advantage over the L-lip plus PSF is lumbar plexus is avoided. High iliac crest for L4-5 is not a problem. L5-S1 is also accessible. So this is SPS that I advocate. I just showed you.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.